I think we have your permission to record this, correct?
Yes.
So I would think that when you were off at your mission trip, that you acquired the COVID on your mission trip early, not late, probably within the first two or 3 days.
Correct.
And that's how it went through the entire crowd. And there was a point in which the people there were singing, correct? They were singing songs?
Every day.
Every day, which is wonderful.
One song every day.
One song. But when you sing, as I've about exhaling virus, and that's on my website, that you actually exhale more virus. And nobody's died, have they? Nobody's, no. Which is wonderful. And what I've been talking with you about is that there are new variants in the USA. The Delta variant is now the dominant variant. What I've talked to him about is he knows that I have intestinal exposure last year. Isn't that correct? I explained that to you, that I exposed my intestines. He knows that I've had exposure to my intestine at least on 5 occasions. Correct? I told you that.
Yes.
He knows that I've had exposure through inhalation on multiple times last year, right? And am I wearing a mask today?
No.
I'm not wearing a mask. He's not wearing a mask, right?
Correct.
And I think my last known contact with coronavirus would be months ago, maybe 2-3 months ago, something like that. Okay, not bad. And one of the things we're going to do today, I've been talking to him about intestinal immunity, the Antivirus Air website, and I'm going to demonstrate on this video, I'm going to demonstrate me swallowing COVID virus. And we're going to see if that's the new variant. Now, here's what's interesting, is when I swallow the new variant, how long will it take for symptoms to occur? And will I have any symptoms? On the one hand, because I had so much variant exposure in the past, and I actually had that confirmed by a lab that actually grew it out in my stool. So we're not talking about hypothetical. We're actually talking about proven gut exposure. Will this cause diarrhea? Maybe. And I would expect that if I get a diarrhea, I will get it probably on the 2nd or 3rd day. There is a chance that my body already has the necessary antibodies that when it comes in, it will suppress it and I may have no symptoms at all. So I'm going to take enough live virus of this new variant to make sure I get adequate intestinal exposure. And then I'll be looking for what type of symptoms occur and probably have a little symptoms, GI symptoms or no symptoms. Now, if you'll notice, I've been talking to him for about 45 minutes in this room or an hour. He's still in the respiratory phase. Most of his virus was spread in the asymptomatic phase. So actually he exhaled more virus a few days ago than he is now. But obviously I'm not worried about it. I've already had coronavirus. Now, there was some arguments that a natural infection did not protect people. Well, I guess if I die from coronavirus, that'll add some strength to it. But I'm not going to die from coronavirus. I'm not going to have any pulmonary pneumonia from it. And I may get a little bit of diarrhea when I swallow the live coronavirus. Is that necessarily a bad thing? I don't think it's a bad thing because it gives my body, my intestinal tract, a chance to educate itself on the new variant. So, and I may have no symptoms whatsoever. Okay. Now, what we have right there is a capsule with the coronavirus in it of the new variant. Now, today's date is, what's our date today? July the 8th. July the 8th. And so this variant was actually picked up in Kentucky. So it was a Kentucky variant. But I'm thinking it's probably going to be the Delta. And it probably was very well spread. So I think that this is probably going to be a Delta variant. I'm going to try to run a PCR test on this and get the exact type just for, documentation purposes. But here it goes. Let's see. Now, what do I think will be the effect of that? I think the effect of that is going to be that I might have a little bit of diarrhea in 2 days, 3 days maybe. It's kind of interesting because when am I going to get pulmonary COVID from eating it, from eating the new? Absolutely not. Okay. Now, will I get pulmonary COVID from breathing the air? There is a slightly larger risk that by being here in the room with him, that I will be inhaling it, and this virus, and it might get in my lungs. However, my old immunity was outstanding. I probably have better immunity due to my multiple exposures than almost anybody in the state of Alabama, because I deliberately exposed myself multiple times to both intestinal and then following that to respiratory. There is a word of caution. Number one, you should not ever watch this video by yourself and make any health decisions on these matters by yourself. Your local physician is your best source of information. Now, unfortunately, your local physician has been kept out of the loop. You know, your local physician's not even used to prescribe the vaccines. They just sent them home, told them to go home, stay home, didn't educate them, didn't treat. Well, okay, there's some guidelines. CDC has some guidelines. But they didn't ask for help or guidance from community physicians. So why is it that I can take a live coronavirus variant and the CDC can't do that? Partly because the CDC has these very complex rules regarding human testing. They have all this paperwork. You'd need a mountain of lawyers, a mountain full of money, and you still probably wouldn't be able to get your first volunteer to take live coronavirus. Because the liability involved in that when people are enrolling in studies just becomes overwhelming. There were many people that are physicians that are trailblazers. They want to learn. And part of learning is doing experiments. I mean, I've done experiments on a bunch of different things in my life. Experimental process is how you learn. Now, the way the CDC learns is it waits for things to happen by accident and then tries to infer things from it. The CDC is right now having problems explaining why the new coronavirus variant, which is Delta, is all across Missouri, and yet the death rate in Missouri is really low. So I would expect that this is probably Delta, that I have a very well-educated immune system. No one should imitate what I'm doing, especially not wearing a mask. The most risky thing that I'm doing today is I'm not wearing a mask around somebody who's known. But, you know, like I said, that's my concern. I am an advocate for the development of natural immunity from natural exposure to the intestinal tract. It is well known that within 10 days of your last symptom of exposure to your intestinal tract, you are likely non-transmissible, even of the new variant. So the fastest way I can be non-transmissible of this current variant is to expose it to my intestinal tract. So in a way, society will gain something from my intestinal exposure today. I won't be transmissible probably within 10 days because I exposed my intestinal tract to it. So now what price will I have to pay for that? I might have 1 or 2 loose stools 3 days from now, maybe. I may have no symptoms at all. I would like to see whether it actually grows out in my stool, the new variant. And I may send off, I used a lab last year to confirm it growing in my stool. I may do that as well. But at any rate, let's go back to our person we're interviewing here. First of all, I'd like to thank you for donating your COVID virus that you grew for research. That will help educate my intestinal immune system. It will help me make a better defense. And I appreciate that. Thanks for the glass of water. And what we're looking at here is some of the things he got prescribed. Oh, I don't want to show your name on any of these. So we're going to leave those names off. Okay. But to look at some of these, he is on famotidine, which is Pepcid or Prilosec. Pepcid is commonly prescribed and was prescribed to Donald Trump because it probably works by letting more of the virus reach the intestines early. You had some GI symptoms, correct?
Correct.
What day was your first GI symptom?
Probably Monday.
Okay.
His first slight one, and today was the first full symptom.
Okay. He finally got into the GI phase of coronavirus. That I consider a good sign. What that means is it is growing in his intestines. His body has recognized it. All right? You comfortable with us discussing these issues?
Yes.
And when his body recognized it, his body decided to dump it out. So he pooped. And when your body doesn't like something growing inside your intestines, you know what it decides to do? It says it's got too much of it, it poops it out. Okay? Now, I can send you all sorts of... There's not been a single case that I know of that somebody's bowels died due to coronavirus infection. Your lungs can get torn up, but your bowels don't get killed. Does that make sense? Yes.
Makes sense.
That's the layman's version without being overly technical. So his symptoms really started today and a little bit on Monday. A little bit of a loose stool, but you've had really real diarrhea. And you'll know that type of viral diarrhea feeling because you really have to run to the toilet. As in, it's not optional. You got to go. I mean, it's not like, hey, I'm going to wait an hour for my conference to be over and then I'm going to go down the hall to the toilet. It's like within 5 minutes, if I don't go, I'm going to stool on myself, basically. It's not a choice. And that's part of your body's protective mechanism. You see that in intestinal responses to viruses. And that should be considered, I would classify that as an intestinal response to the virus. I consider that a good sign because that means your intestines are processing. They're beginning to recognize it. You have a problem, though, in that you're having respiratory symptoms. Isn't that correct?
Correct.
And you cough. How much of the night are you coughing?
On a pretty regular basis.
And it wakes you up, right?
Yes.
Do you have sleep? You've never been officially diagnosed with sleep apnea, correct?
I have not, but I'm pretty sure I haven't.
You know, so many people have sleep apnea. It's very common. It's hard to treat. But, you know, I wrote the CDC and I asked them to get the public informed on snoring as a risk factor for COVID. Now, was your wife with you on your trip?
No.
Just you?
Yes.
Okay.
And my youngest son.
And your youngest son. Youngest son didn't get sick.
He did not.
He had to, I would expect that with so many people, was he ever positive?
No.
I would expect that he was inhaling just like everybody else was inhaling, but that his immunity was strong enough that he didn't grow. So it's not for lack of exposure. That would be my guess. Okay. Right. Does that make sense? I think and I think that you're at higher risk. I think your risk factors are related. You're how old?
51.
Okay. He's told us, and you don't mind us putting that out. Okay. How far do you think you are from your ideal weight?
About 80 pounds.
I don't know.
70 probably.
Maybe, okay.
About 70 pounds. 70, 80 pounds.
That being said, I would say you're pretty much the normal American 50-year-old male. Don't you think? Don't your friends look like you? You buy your clothes same place as everybody else, right?
Yeah.
I mean, that kind of weight gain is pretty, it's fairly normal. Do you find me? However, one of the other risk factors that he's looking at is this snoring. As I've told him, coronavirus can be in your saliva and in your upper airway because it grows in your lungs and you can breathe it up to your mouth. You can dry it out. And I proposed to the CDC last year that they warn people to get treated for sleep apnea and ways of stopping the snoring from being inhaling coronavirus. To my knowledge, the CDC didn't ever follow up on that. As you probably picked up, the CDC doesn't listen to me that much. But then again, CDC has their own problems. I guess that's a good one. And I shouldn't be critical of others. Don't complain to others unless you want to do their job, right? That's all. Isn't that right? And don't walk, Don't criticize a man till you walk a mile in their shoes. Well, I've never been the director of the CDC. I'm sure they have all sorts of problems that they have to address and deal with. But one of the things that's, if you have snoring, it is very important, I think, that you deal with that as an issue when you get sick. So what are you going to try to do? You're going to try to avoid snoring, correct?
Correct.
You're going to try to take anti-snore spray. You're going to try to sleep on your side, not your back. Do you elevate the head of your bed any?
No.
You know, one of the things I try to talk to a lot of people about is, if you have snoring, elevate that head of the bed. Usually you don't have one of those automatic adjust beds, do you?
I don't. I just use 2 pillows.
Okay, you can use the concrete blocks. You know, the concrete blocks, you put them up at the head of the bed and you elevate to about 8 inches. Initially, that puts your whole bed on a slant, but I like that better than sleeping on a bunch of pillows. The problem with sleeping on pillows is they can get cocked behind your head and push your neck down. And that's not good. You know, that's not healthy. So, and you know, as I always tell people, a good day begins with a good night. And what we want to have is a good night's rest, especially when you're sick. And, you know, if you go several nights without rest, it's going to make you feel very tired during the day. It makes it, even though I don't think he's going to die. Is that fairly reasonable? And in fact, I think your risk of death is really rather low. But you can feel miserable from not sleeping well. And in fact, you see that with sinus infections. You had sinus infection a while back, didn't you?
Right.
And when you're not sleeping at night, you get that burned out feeling. The longer it goes on, you get that burned out feeling that's very, very unpleasant. And any rate, so what we're going to do here is, actually, I've already swallowed the capsule. And so we're going to document later how I did. This is human experimentation by somebody, and I'm a physician, but I'm also somebody who already had multiple prior exposures that were confirmed. These are not for you to imitate on TV or on YouTube. These are informative articles, and really they should be interpreted primarily by medical people that are your physician. Your average physician, if they study these issues, if they go to the websites, they have the intelligence to understand most of this. They're not stupid. As for the CDC, there's not one government employee that has ever been asked to engage in live virus experimentation in the United States. So when you ask yourself, why does the CDC know so little? Then part of that answer is the CDC employees do not experiment with live virus on themselves. It's not fair for you to ask them to, because they may be afraid of coronavirus, or they may just have a fear of dying, or they may not feel the risk benefit is worth it. They may be paranoid. They may have other agendas that I don't know why it's not for me to answer why they don't engage in experimentation. Clearly, my friends and my families and those that work with me are going to be exposed to the new Delta variant. If the CDC can't give me answers, well, guess what? I can get a lot of them answers myself. Some of the answers and some of the research I can get are actually more helpful for me to make my own decisions than what the CDC provides. That's why we have these websites out. I do want to thank the Small Business Administration for their support. I want to thank the other physicians that we work with. Human testing should never be done without consent. Notice that he was already infected. I'm not infecting him. I'm getting his virus when I already have an educated immune system and reintroducing it to see what effect it'll have on me. If you have any issues with this, you can address them to the website. But I'm expecting that maybe in 3 days I might have a little bit of diarrhea. I'm going to have probably 1 or 2 more capsules before I go, because I want to make sure I have adequate exposure. And I want to make sure that I get enough exposure that my intestinal tract will have contact with it. I've been in here for about an hour or two talking with you, and I've really enjoyed his cooperation. I will probably, and I appreciate his work today, and we'll keep you updated on how it turns out. So consider this the first live demonstration of oral inoculation of the new coronavirus Delta variant. We don't know exactly what variant type it is. I'm going to try to send it off to the PCR lab and we'll find out. Thank you and have a wonderful day. Make your days count and count your days. Thank you.